Most of you in the audience were probably brought up with the general belief that girls are nurses and boys are doctors, and maybe there were a few exceptions to that rule, but that was the general status quo. While that belief is gradually changing and both fields are getting influxes of the opposite gender, this is still, somehow, a widely held social standard. When the girls in this class walk into the hospital, the first question we are often asked is, so you're a nursing student, or do you want to be a nurse? Well, the guys in our class report that they've never been asked this. Although this may seem like a harmless question, it is actually quite odd for us to be asked this. With the rates women are going into all roles in healthcare in addition to nursing, you'd think this question would have faded away years ago. MD programs now have entering classes composed of 54% women. Just 40 years ago, only 25% of medical students were female. That's progress. Over 75% of physician assistant students, 85% of nurse practitioner students, and 85% of nursing students identify as female. So why are we still asked this question? Isn't it obvious that women are going into all roles in healthcare, that we basically make up the healthcare system? Why are we still only thought of as one piece? That's an incredibly complex question, but one I hope to answer within the next 10 minutes. The first piece of this equation is why do so many women go into healthcare, a field that has historically mistreated them as both patients and providers? To explain that, we have to give credit to the same power structure that created the original barriers into healthcare, historical gender roles. These gender roles encourage women to develop more feminine traits, such as creativity, empathy, mutual connections, emotional skills, and nurturing traits. Values all extremely prominent in healthcare. Because of this encourages women to find roles in healthcare as they generally fit the description so well. However, these preset gender roles and beliefs are also what keep women from being offered positions that hold significant power to impact and change the current system. And if we continue to uphold these beliefs, nothing will change. Because women are conditioned into what experts in the field refer to as care roles, and men are pushed more towards cure roles, we see dramatic disparities in the large number of female providers we have versus those who go on to receive promotions to run departments or hospitals. The World Health Organization reported that in 2019, women make up 75% of all roles in the hospital, but only hold about 25% of the senior positions. Although these numbers may be slightly skewed based on the age of those going into these positions, this is still an insane disparity. Because of the lack of women in administrative or senior positions, we are less likely to see changes to the healthcare system that produce benefits for women. To this day, women are still less likely to be diagnosed with a heart attack or given the incorrect medications to treat it. Women's pain, especially that of a chronic nature, is less likely to be taken seriously, resulting in a staggering 10% difference in getting prescribed painkillers. And none of these things are subject to change until we see more women in positions of power and healthcare education who are able to make these adjustments and inform the future providers of healthcare. And these gender stereotypes in healthcare don't just affect women. Because men in healthcare are pushed more into these cure roles, we see fewer males choosing to go into primary care, nursing, or other incredibly important roles. This is a problem for both the healthcare system and the patients it provides for. For one, the social barrier to a man becoming a nurse prevents many qualified individuals who could provide great care from pursuing this career path. Subsequently, we then have fewer male nurses to provide care to individuals, making it sometimes difficult or awkward for men to seek out healthcare. Although theoretically, people can and should feel comfortable going to any licensed healthcare professional, practically, we know this is not always the case. I wouldn't want a man as my gynecologist, and I'm sure the men in their audience wouldn't want a woman as their urologist. Men, especially older men, are also at a societal disadvantage to seek out healthcare based on the ideas that they were instilled with to believe that they should tough it out or be a man. By encouraging more men to go into these care roles in healthcare, we can begin to break down the barriers of the idea that men should only be tough and stoic and encourage future generations to be able to receive the best care possible, regardless of their gender. More men in care positions creates the opportunity for education and undermines traditional harmful stereotypes, subsequently encouraging a new outlook on how care should be given and received by men. Although ideally, we could eradicate the barriers that prevent men from seeking healthcare immediately, a more realistic solution is producing more male providers, nurses, therapists, and techs to ensure that comfortable care is available for all, both now and in the future. Ultimately, I've stood here and talked about how messed up our system is, but I'd like to finish off with a few positive notes. As a society, we are slowly but steadily beginning to move away from this way of thinking, and while we still have a long way to go, we are beginning to see positive change. Men are going into nursing at the highest rates in history, and as previously mentioned, women are now making up the majority by a slim margin of medical classes. As the years go by, we are beginning to see more and more women earn their way into positions of power, and there's been a recent push to destigmatize men seeking help, especially in the mental health field. So, what can we do? Although you and I can't change the entire system, we can be mindful about the way we think and talk about roles in healthcare. This not only influences our way of thinking, but those around us, creating a positive ripple effect and creating a small but meaningful difference. I hope that within our lifetime, we're able to see the negative effects of gender roles diminish until we cannot even remember what they once were. Thank you.